Hello, and welcome to this special interview series on Nourishing Knowledge, the power of food as medicine. I'm Wanda Malhotra, lifestyle journalist and CEO of Crunchy Mama Box, a platform promoting conscious living. Today's interview is part of a powerful collaboration with Authority Magazine, a medium publication that delves deep into topics that truly matter. Today, we will have the pleasure of speaking with Eziah Syed, who has spent his career steeped in technology, strategy, and innovation across a variety of large corporations and startups. Currently, he serves as co-founder and CEO of Mend, a life sciences company operating at the intersection of digital health and Nutri Pharma. He has deep experience in innovation, new products, ventures, and white space growth opportunities with a focus on technology-based solutions. This video is a special follow-up to the written interview previously published. For a deeper dive into the complete conversation, follow my column to read the full interview. So now, join us for an exclusive interview with Eziah Syed. Hi, Eziah, and
Hi, Yolanda. Good to talk to you.
Great talking to you. Thank you so much for doing this with us.
Oh, absolutely. It's a joy. It's an important topic, and I'm happy to talk about it.
Super. So can you share a specific personal experience or pivotal moments from your journey in the field of digital health and Nutri Pharma that significantly influenced your career trajectory and approach to wellness?
Yeah, I think it was really a culmination of things, which started way back when my mom was diagnosed with breast cancer roughly 10 years ago and had a full mastectomy and a pretty brutal recovery from chemo, et cetera. And then my brother had a very significant accident falling from Catterskill Falls, which is roughly 80 feet. He fell down and had to be airlifted out in a helicopter, et cetera. He had 8-9 surgeries to repair his, extensively damaged body. And I saw kind of the care that they got, as well as the lack of care, the gaps, and that was starting to kind of, I think starting to germinate in my mind. And then I was training for the New York Marathon, and I had a stress fracture from all the training, and it was very slow to heal. And I was in a boot for, ended up being much longer than it should have been. And I went back to my doctor and I asked, the question which many patients do is like, what more should I be doing, or what can I be doing? And the response I got was totally unsatisfactory. Let's just go home and rest. And so that was sort of the first aha of, hey, wait a second, am I nutritionally compromised? And if I am, why isn't my doctor talking about that? And I started to do research in that topic, and nutrition and healing, and realized that there was, there's abundance of information out there that when the body's under trauma, the need state goes up for nutrients. This is not rocket science, right? The body's working harder, it needs some of the building blocks of the tissue that it's trying to repair. And yet it wasn't being used in medicine in an effective way. And so I realized that there was a significant opportunity for an evidence-based, food as medicine, what we call Nutri Pharma company that could actually get into conventional medicine, get your mainstream doctors and surgeons saying, hey, here's a body of evidence that nutrition matters, and use that as a real kind of anchor for the firm. And that's where we are today. The other gap really was that my mom unfortunately had a second breast cancer surgery recently, and a joint replacement as well, and she's 80. And there wasn't the support in the episode of care that I felt really could have benefited her. Both her emotional well-being, the stress, and all that kind of stuff, but the actual principles of what's called enhanced recovery after surgery, and how that could have been deployed with her in a much more active way to ensure that she got good outcomes. So that's really where our combination of food as medicine and nutrition comes into play with digital behavioral health, bringing those two together into a single offering and value proposition.
These are really, really relevant moments in your life. My goodness.
It's been a lot.
I can see where the inspiration comes from to making a difference. So in the current landscape of technology and wellness, which emerging trends or innovations excite you the most, and how do you see them contributing to the improvement of people's well-being?
Yeah, I mean, I think there's so many. I think food as medicine is certainly one of the areas that is really advancing, where folks like Mend and other companies are really starting to put a body of evidence-based, science information together, so that we can actually get into mainstream and conventional medicine. The stats in our society are pretty bleak. We're spending $4.3 trillion on, really a sick care system. So we do a really good job of getting our people sick. And then 90% of those dollars are allocated towards treating for people with chronic conditions. And if you look at the data and charts of chronic conditions, not long ago, it was kind of, let's say, mid 1800s, it was somewhere around, maybe 7% of the population had, adults had a chronic condition. Now it's 60%. So it's been just this trajectory of rise in illness. So, I think food as medicine is really exciting. I think one of the surgeons that we work with has said to me, certainly in the surgical realm, we've kind of maxed out and tapped out on surgical techniques, where he believes will unlock the next set of kind of value will be in healing. And how do we bring evidence into a healing platform that is going to do a lot of things for folks? There's a whole bunch of stuff going on in various tech domains and AI and big data and what have you that I think are going to unlock very significant benefits. But in our space, what we're really excited about is a patient-centered approach around behavioral support. And getting really patient-centric about the experience of being in acute care, and then leveraging a whole multimodal approach, nutrition being one of the core anchors, to drive better outcomes, but using that episode of care, in total joint, for example, a surgery where we're currently heavily deployed, the episode of care is 3,000 hours. One of my doctor partners, Dr. Wickline, likes to say, I spend 2 hours with the patient. Who's with them for the other 2,998 hours, really helping them through that experience. So that's where we're really excited that when you take a whole person approach, not only can you get better outcomes in acute, you can actually develop new behaviors and habits that'll stay with the patient for the rest of their lives. And so that's what we're really, really profoundly excited about.
Wow, that is exciting. That's very, very interesting what you're doing and how you're making a huge impact in this field. Wow, I love that.
Thank you.
So leveraging your extensive experience in senior innovation and strategy roles, what advice would you offer to aspiring entrepreneurs or professionals aiming to enter the digital health and wellness industry?
Yeah, well, first, it's a good time in that food as medicine. I'll get into digital health space is really hot. Kind of two key areas where we've heard repeatedly from the investment communities on our core thesis is around consumer health and food as medicine and digital health. So there are very significant dollars sitting as dry powder in the pockets of investors that are looking for really exciting innovations to put their investments into. So that's good. So the dollars are there, and there's an appetite in the market and looking for solutions. But the flip side is competition is ripe. It is growing, and it's becoming intensely competitive. And so you want to spend really, really long and hard thinking about the core thesis of the space that you're looking to solve a problem in, and making sure that you go through a really disciplined process of identifying a unique value proposition and mission and vision and purpose, and where you're going to play, which space are you going to play in, and then the unique differentiators that allow you to actually win in that space. And there's a lot of good sage counsel out there from business leaders on how to really think thoroughly through that approach. But I think one of the most important things is have a mission and purpose that you live and breathe and love, because it's an arduous, difficult journey. I tell people it's the ultimate roller coaster ride that never ends when you're in a startup. There are difficult days beyond difficult days, followed by difficult days, and the thing that carries you through is your mission and purpose about what it is you're doing, because you can feel really good each and every day about the thorny challenges you're trying to solve, because it will come many and frequently.
That's valuable advice. Wow. Wise words. Thank you. Thank you very much, Eziah. So from a broader perspective, could you outline the key contributions and impact that MEND is making at the intersection of digital health and Nutri Pharma? How does this align with your vision for enhanced well-being?
Well, we're super excited because we're kind of past the prove it stage, in that we have developed a solution that is, like we said at the beginning, operating at the intersection of those two sort of mega trends. And now we're in contract. So we're in contract with numerous providers. We're currently in orthopedic surgery primarily, we have developed a vision and a plan for what we can do in oncological surgery. And I think, again, going back to kind of that core view of ours, that not only can you enhance acute outcomes, and as a result of that, save healthcare billions and billions of dollars, but you can position the patient for long-term health success. It's interesting when you have a major trauma like that. All of a sudden you start to reflect on, why did I get here? Why am I having a knee replaced? And geez, I don't want to end up back in the hospital. What changes do I need to make to not get here? So it's a perfect time to work with someone to really introduce behavioral changes and introduce new habits. So we're proving that out. It's working. We've got unprecedented patient engagement rates in our digital platform. Our doctors are thrilled, and I think 6 months from now, we're going to have a body of data to publish that's really going to get the market excited about our solution.
Impressive. Love that. So reflecting on your journey, can you share a specific challenge that you faced and how it shaped your professional trajectory in this field?
I mean, there's been so many challenges. One of the challenges that I face is kind of this myriad of kind of health personal challenges in family. As you go through the course of building your company, you will face things that were totally unexpected. Early part of building our company and doing our startup, COVID came. Who could have foreseen something like that? And COVID for us was particularly challenging because we are trying to endeavor to do business with hospitals and sell into hospitals and providers. So can you imagine in a COVID environment where they're not touching anything, they're just basically trying to survive, trying to sell into that environment. And then of course there's a COVID hangover because now hospitals are now bleeding money and they're trying to get back on track. And guess what? They're not looking at innovation investments during that period. So, but you have to be resilient and you have to find ways to make your model work. And again, I go back to the purpose and the passion for your mission, because if that's there, you can grind it out. If you have it there, if there's a there, and you really thought well about your thesis, you can grind out the difficult days. And here we are today. We're in dozens of contracts, and and deploying. So we've endured the COVID thing. There'll be something else around the corner, but that was certainly a challenge.
There's always surprises, right? Entrepreneurship is always full of ups and downs.
Absolutely.
So drawing upon your expertise, what message or words of wisdom would you like to share with our audience regarding the transformative potential of nutrition, technology, and behavioral support for achieving better health and overall well-being?
Yeah, look, I think the dollars and numbers tell the story. 60% of our adults are living with multiple chronic conditions. We're spending $4.3 trillion, far more than any other industrialized nation. As forecasted by the end of this year, 50% of our population will be pre-diabetic or diabetic. We're spending $400 billion a year just on that problem. And if you look at all of this kind of illness through the prism of why we got here, it's really quite stark. I mean, for the most of our evolutionary history was the same. We were hunter-gatherers, we were outside, we were active in high energy expenditure environments, et cetera. And then all of a sudden, in the blink of an eye, through that context, a lot changed. We're sedentary, so we sit 8 hours a day. We're only out for about 7% of our time. We are exposed to all kinds of environmental toxins. 60% of our diets are coming from highly processed or processed foods. And so it's no surprise that the biology of our machinery is like, oh my God, what is going on here? This is not what I was designed for. And so there's enormous opportunity as you look through kind of that lens on where we can have an impact and really change human health, because we're in a crisis. It's code red. This is not a sustainable trajectory. And we're talking about, real financial crisis, and not to mention the needless suffering that is occurring across every demographic group with illness. Diabetes is a very serious illness. It can lead to all kinds of really, really bad outcomes, like amputations and loss of feelings in your nerves and blindness and all kinds of really serious things. So we have to start taking these things very, very seriously. And I think the entrepreneurs out there is a sea of opportunity to create impact in this space. And I think it is going to really require whole solutions that really think, sort of the breadth and depth of the problem and develop solutions to address those.
Certainly. I agree 100%. And we truly appreciate your valuable insights and expertise. Your dedication to advancing digital health and Nutri Pharma is inspiring. Thank you so much for sharing your valuable words, your wisdom, and we wish you only continued success on your great work.
Thank you, Wanda, and thank you to Authority Magazine and yourself for taking on a really important topic and elevating it. I think we all need to continue to do that until food as medicine, behavioral health become a cornerstone of how we think about healthcare. So thank you for having me.
Thank you.